Good afternoon. Is everyone excited? You all are the first to experience this workshop, so I'm excited to be here. Again, my name is Lisa Ronquillo. I'm a public health analyst. I actually work in San Francisco, which is one of 10 regional offices. I work for the U.S. Department of Health and Human Services for an agency, which is a funding agency called HRSA, which is the Health Resources Services Administration. And I work for a bureau called the Bureau of Clinician Recruitment and Service. And our headquarters is located in Rockville, Maryland. And we have 10 regional offices located throughout the country to support our sites and clinicians, hopefully some of you in the near future. BCRS, as you'll hear me say throughout this presentation for the Bureau of Clinician Recruitment and Service, is responsible for overseeing 7 programs: the National Health Service Corps Scholarship Program, the National Health Service Corps Loan Repayment Program, the National Health Service Corps State Loan Repayment Program, the Faculty Loan Repayment Program, the Nursing Education Loan Repayment Program, Nursing Scholarship Program, and we also have a Native Hawaiian Health Scholarship Program. Today, I want to talk with you about the National Health Service Corps. Has anybody ever heard of National Health Service Corps, by the way? Yes. Great. Well, I'm really excited to go over the history. It's actually been around for a long time. I think it's gained popularity here in the recent years. But the National Health Service Corps was originally created in response to a shortage of providers back in the 50s and 60s. There were many clinicians that were retiring and leaving the area without critical services and access to primary care for the people living in communities all over our nation. So in the 1970s, the National Health Service Corps was created. And originally, it only offered scholarships. In the 1980s, it gained more clinicians. And as we refer to clinicians in service, you'll hear us call the field strength report. We were able to add loan repairs to that mix. So we were able to expand and increase the number of clinicians serving in our communities. And our field strength continued to grow. In the 1990s, there was a budget shortage that was not anticipated, and so our field strength actually was reduced. And I'm excited, and I'm here to tell you that in the 2000s, our program has changed. We're actually now experiencing an increase in funding unprecedented in the history of our program. And through the Affordable Care Act, we have mandatory appropriations right now through 2015, and we're averaging about $300 million per year to support scholarships and loan repayment for primary care clinicians to serve in underserved communities. And in the last 3 years alone, we've tripled our field strength from 2008 to 2011. So let me talk a little bit about National Health Service Corps today. And I also want to draw your attention that the pictures that you'll see throughout this presentation, they are real clinicians currently serving or alum in our program. So I'm really excited to share that with you. Today, we actually have, currently speaking, in October, we are recently making awards. This number is no longer 8,000. We anticipated and hopefully have met by now over 10,500 current clinicians serving in the National Health Service Corps. And we're providing care to millions of individuals and over 12,000 sites across our country. And this is just to give you a picture of the type of disciplines that are represented by our clinicians, and you can see where we're needing to grow. So we're definitely needing to increase the number of physicians serving in communities, and certified nurse midwives, nurse practitioners, physician assistants, dentists, dental hygienists, and we have a variety of mental health providers now that are serving with our program. So let me talk to you first a little bit about scholarships. And I'm really excited. You know, when I think about the opportunity we have here with AMSA, with this event, you know, this is the time where you're making decisions. You're making decisions about where you feel called to serve, what type of medicine you want to practice, and obviously you're thinking about finances. How am I going to pay for my medical education? So I'm excited to tell you that we offer scholarships through the federal government. It's a competitive process. We receive over 4,000 applications on average a year, and we're only able to award 250. So it is competitive, but I don't want you to be discouraged. I want you to apply. This is some of the criteria. Excuse me, this is not the criteria. I beg my pardon. This is what a scholarship includes is a full ride tuition, Your fees, your books, your instruments will be covered tax-free. There is a taxable living stipend of a little over than $1,200 right now is what we're offering, but there's much more. We also assist our scholars in relocating to their new service community by paying a one-way relocation expense when they're ready to begin practicing at one of our approved sites. I'm sorry, I didn't. And so the way this works is for the numbers of years of financial support that you receive would be equivalent to the number of years of service. We have a minimum 2-year service requirement. So for example, if you only received 1 year of medical education support from our program, then you would still have a minimum of a 2-year commitment. So you'll serve anywhere from 2 to 4 years. And this is really an opportunity beyond what the finances of this are. We really want you to see that you are a part of something greater. In our country, there's a need. There are people, there are communities that need you. They need services. And that's really your take-home pay. Honestly, at the end of the day, when all your debt is paid, it's the services. It's knowing that you're making an impact in the communities. And I want to just encourage you. All of you heard at the keynote address, Dr. Richard Carmona, who is the 17th Surgeon General of our country, and he was giving you a charge to serve. And I want to encourage you because what we didn't talk about was the 18th Surgeon General. So our current Surgeon General of our country, her name is Dr. Regina Benjamin. Dr. Regina Benjamin used to be a National Health Service Corps scholar. She had her entire medical education paid for. She attended the Morehouse Schools of Medicine, and she actually founded a rural health clinic in the Bayou La Batre in Alabama. And she saw a need. There were underserved and uninsured people living in a fishing village, and she founded a clinic, and her efforts did not go unnoticed. President Obama named her the Surgeon General of our country. So not that everyone's going to be the next Surgeon General, but I want to encourage you that you can make a difference. So this is some of our criteria for eligibility: that you must be a U.S. citizen or national to our country, that you'll be a full-time student in an accredited school pursuing a degree in primary care medicine, either as a DO or MD, and this includes family practice, internal medicine, geriatrics, pediatrics, and OBGYN, dentistry, either as dentist. We also have nurse practitioner, certified nurse midwives, and physician assistants. How to apply. So I encourage you to visit our website and review the application and program guidance. And you can do that by reaching www.nhsc.hrsa, which is HRSA.gov. Now I'm going to transition a little and I'm going to talk about the other funding opportunity that's available to you, and this is loan repayment. And let me just pause for a moment. So loan repayment's a little different. Loan repayment is if you were to take on your entire medical education and pay your way through school by taking on this debt, then sometime during your schooling you're going to be thinking about where you think you might want to practice. And I would encourage you, as you're considering private practice or specialized care, to really consider a career in public health. And one way you can do that is by working at one of our approved sites. We have community health center settings, we have prisons, we have Native American reservations, we have a variety of types of clinic environments for you to work in. Some are in rural settings, some are in urban settings. So there really is sites in every part of our country. And you can become familiar on our website under the Sites and Communities tabs for all the possible sites that are approved. In order to apply for loan repayment, you must first have employment at an approved site. So that's kind of the baseline. You're ineligible to apply if you're not at one of our approved sites. So I encourage you to become familiar with our site and visit that regularly. We're also adding new sites fairly regularly. On a monthly basis, I think we receive applications for new sites. So please check that out. Currently, what we're able to offer, and at this time it doesn't apply to you, but it's good for you to know what's available at this time, is up to $60,000 in loan repayment for your qualified educational loans in exchange for a minimum 2-year service commitment. Now the interesting thing is that you can continue to apply on an annual basis and continue to receive loan repayment while you're working at an approved site up to, for example, in 5 years, up to $170,000. We do have some clinicians, their debt far exceeds $170,000, and they continue to apply and receive loan repayment until their debt is paid. So again here, with continued service beyond 5 years, that you can be able to pay off all of your student loans. So that's kind of hope. And again, you know, you're getting to pay off your student loans while you're providing care, and you're in the practice of medicine to help people. So just know that your daily reward, that you're making the impact, is making a difference. That's your take-home pay. We're excited to actually offer now half-time service. So initially it was only a full-time service commitment, and now we're able to offer half-time. And that was really based on feedback that we were receiving from potential applicants, that they would really be interested in our program if they had an option for half-time. So for instance, you could receive up to $60,000 over a 4-year service at half-time, or you can receive up to $30,000 over a 2-year period. And when I say up to, I just want to clarify that that means if, let's say, your loans were only $47,000, then you would only receive up to $47,000. You would not receive the difference. So just want to make sure that that's clear. So this is a great chart. I really love whoever developed this, because it helps to explain what I just said. And so this kind of shows you the numbers and how this can work. So I'll let you view this just for a few moments. We also want to really reiterate, I think there's a misnomer, a misunderstanding, and maybe we're not articulating this clearly, so I'm hoping I'll be able to clarify this for the record. Whether it's scholarship and you receive a full ride medical tuition paid for, you are not working at one of our sites for free. You're not paying back your scholarship by working as a volunteer. You're going to receive a competitive salary at one of our sites. And the same thing with loan repayment. Sites are not able to reduce your salary because you receive loan repayment. It really is designed to ease the debt burden so that you can focus on medicine, so you can give your attention to the duties and activities that are involved and not have to worry about how you're going to pay for your mortgage or your car payment, okay? So with loan repayment, again, I want to reiterate, you must first find a job at an approved site. Then you're able to apply for loan repayment. And one way you really can get familiar with sites, excuse me, I'm ahead of myself now. Additional benefits is that you can also now have a portion of your time, if you're teaching at a health center or another site that's approved, a portion of that time can be credited to you for your service obligation. We're also really excited to announce that we have new opportunities for virtual and face-to-face networking among other clinicians across disciplines. We have worked with, when I say we, National Health Service Corps has worked closely with the Morehouse Schools of Medicine to really create a virtual training network and community where you all can continue with your CEU credits. Sometimes traveling is not financially or time-wise available to you for you to have your CEUs. So now there's live webinars for you to participate in and blog discussions on various topics. So we're just really excited because that's exclusively only available to National Health Service Corps clinicians. It's not even available to the doctors and nurses that are working for the government even, and to the general public. So this is something specific and specially designed for our participants. We also have occasionally face-to-face networking opportunities. So these are something new that we started, and we see that there's an interest to continue these. And this is just an opportunity for you to get together in various cities around the country with other clinicians such as yourself to really see that you are a part of something much greater. And again, it's these rewarding relationships that you build with patients. You really become part of the community, working in these underserved communities, and you may be the sole best friend of some who are coming in for their care. So it's really exciting about the difference that you can make on a clinical and personal level. And here's just another picture again. These are real clinicians, so it's really just exciting to make a difference in other people's lives. And that, you can't put a price tag on it. Again, for our program for loan repayment, similar eligibility requirements. You must be a U.S. citizen or national. You must currently be working or applying to work at one of our approved sites. So within 30 days of signing a contract at one of our approved sites, you would need to begin working. I want to encourage you all to not consolidate any non-educational debt with your educational debt. So no car payments, no mortgage payments, no credit card debt should ever be consolidated with your educational debt. It would not be eligible for loan repayment. The government would have to be able to see distinctly where your student loans are. So, and you must have a license to practice medicine in the state for which your current site would be located. So again, some of the eligible disciplines for loan repayment. So for primary care, we have physicians, nurse practitioners, certified nurse midwives, and physician assistants. For dentistry, we have dentist and dental hygienist. And we have a variety of behavioral health professionals. We have psychiatrists, health service psychologists, licensed clinical social workers, psychiatric nurse specialists, marriage and family therapists, and licensed professional counselors. Again, how to apply. I would encourage you all to become familiar with the program application and guidance on our website. You will find a job at one of our approved sites. And there's a website there, nhsc.hrsa.gov/search_HPOL.ASPX. And again, apply online. We typically have one time per year an open application cycle for loan repayment. It tends to be in the fall. But for both programs, what I would encourage you to do is sign up to receive email alerts when that application cycle is available. Let me talk a little bit about some of our approved sites and what makes an approved site. So first of all, these are sites that are located in what you will hear repeatedly, a federally designated health professional shortage area, or HPSA. And these sites located in these shortage areas agree to see all patients regardless of their ability to pay. So it's not just the patients that an NHSC clinician would serve, but it's the entire site. That is kind of the foundation of our program. So all patients will be seen regardless of their ability to pay, and that there is a sliding fee discount available to patients based on their household income and family size. And that is also based on the federal poverty guidelines. We have many individuals living at or below 200% of poverty. So we want to make sure that it's affordable and accessible health care. Also that our sites would accept patients covered by Medicare, Medicaid, and children's health insurance programs. That they're a fiscally sound clinic. We want to know that they're in business and they're going to stay in business. And we also want to make sure that they have the capacity to financially support you all with your salary, with your benefits, and that they would provide malpractice and tail coverage to you. Many of our community health centers also offer what's called Federal Tort Claims Act. It's another type of coverage for malpractice. This is a map, and this is just to show you that in every state there are lightly colored, it's very difficult to see on this projection, there's lightly colored green, and those represent where there are loan repayers serving in sites, and there's blue colored dots which represent scholars sites. And again, the scholars are going to serve in areas of greatest need. And again, that HPSA, you're going to hear this term a lot, the health professional shortage area. States survey the access to and availability of providers to meet the needs of patients in the community, and then sites that apply to become approved are given a score. And so they have scores that range from 0 to 26. And right now, our current placement cycle, just to give you an example, we have scholars that will be graduating in 2012, and they right now need to be placed at sites with scores of 16 or higher. So that just gives you a sense of where the greater need is. So sometimes they're in very rural locations. Now this is another opportunity for you to get experience with community health. And if you visited our booth, we also were distributing some literature for a search program. And I'm going to focus more on search because California has a search program. The Collegiate Health Service Corps is not available in this state, so I'm not going to cover that at this time. But the search stands for Students' Experience and Rotations in Community Health. And these are some search participants at a site in Hawaii. And all National Health Service Corps disciplines are eligible. And you know, I really encourage you, if you are considering what it's like to serve in an underserved community, to really go through the process of trying to line up when it's time for you to do your formal clinical rotations, to see if you can't work out a rotation at one of these sites. It really gives you exposure, and quite often when people have done a rotation, they tend to actually go back where they had an experience. So I'd encourage you to do that. And again, it gives you an opportunity to have feedback and support from supervisors and preceptors. California is one of 29 states that has a search program. And here are some useful resources that I would encourage you to visit at your leisure. It gives a lot more information about the details of our program. We have National Health Service Corps Scholarship and Loan Repayment, Nursing Scholarship, Nursing Education Loan Repayment, Faculty Loan Repayment, the search website, and yes, we're also available on Facebook and YouTube, and we also have Twitter. This is my contact information. Please feel free to email me with any questions you have, or as you're going through the process and want to bounce some ideas or get some more insight or direction, feel free to call us. We're always available to support you at every step of the way of your process. And at this time, I'd like to and I'd like to also let you know that at the end of this session, we have contact sheets available if you'd like to sign up and be added to a listserv that you can receive periodic updates. We have a newsletter that goes out. Also, it highlights stories from the field, so you really can read and possibly identify with some of the activities that are being done. Also, there's a business-sized card that has our website, as well as my card, and my colleague, Commander Diane Williams, and she's with the U.S. Public Health Service. I don't want that to be confused with the National Health Service Corps, but she's also available to answer questions, and her information is also available at the back. So I'd like to open the floor up for questions. Oh, thank you. I know it's kind of like drinking from a fire hydrant, so lots of information. No questions. I covered everything. Great. Oh, yes, question in the back.
I'm wondering if for the scholarship program, you can do the part-time service at the end. So let's say you did 2 years, you got 2 years of school paid for. Can you do 4 years of part-time service, or is it only full-time? I know you mentioned for the loan repayment you can do part-time.
Right, and right now my understanding is that scholarship is limited to full-time service. But that could change because we have lots of requests for changes to our program to meet the needs of our clinicians. So stay tuned. And I'm sorry, let me repeat the question. The question was for those participating in the scholarship program, if half-time service would be available when it comes time for them to fulfill their service obligation. And right now at this time, we're offering full-time service requirements. Thank you. Yes?
When it comes time to fulfill your service obligation, and if you want to specialize in something that's not listed, like say if you want to do neonatology, I know that falls under the category of pediatrics, but can you serve your child?
Okay. So the question was, if you, when it comes time for you to fulfill your service obligation, if you're interested in doing specialty, could that time count for your service? And the answer is no. At the time, this is why it's very important for you to read and become familiar with the program application and guidance. So when you sign a contract, you're signing a binding agreement with the government and agree to fulfill and meet the terms of contract. And so at this time, it's not eligible for specialty care and specialty services. We're focusing right now on primary care services. And you don't want to default, so you don't want to sign a contract and later on if something comes up frequently where people have situations, but we do need you to fulfill your service obligation. So please count the cost also as you are considering signing that contract. Thank you. Yes?
About loan repayment, are there situations where people are not accepted for the loan repayment program even though they're working at an official site?
Yes. So good question. The question was, are there times or instances where individuals working at a site might not be awarded loan repayment? Something to that effect? Okay. And yes, that does happen, and it can happen for a variety of reasons, so we don't want you to be discouraged. We receive many more qualified applications than we're able to fund. So please keep that in mind, and if that ever does happen, I would encourage you to reapply. It also does take into consideration there's a personal credit history. They also look at the National Practitioner Data Bank to see if there's any adverse actions. So there's many other factors that are taken into consideration when they're reviewing. And so they're also looking at scores of sites and looking to where the care is needed most. So there's many factors that goes into whether or not loan repayment is awarded. So if for some reason you apply and you're not awarded, please continue to reapply in the future. Thank you. Yes.
Lisa, a question came in from the Twitter feed. For the scholarship program, does the residency match? Does that match up with where you do your service? I think the question is ultimately, what is the order in which you do your match, you do your residency, and you do the service? Okay, and that's a good question. Do I need to repeat that since that came from? Okay. I don't know who's getting recorded at this time, so thank you. So my understanding, and you know, I'm going to speak out here. So my understanding of how this works is that your placement, you're going to work with a placement advisor that's going to help you match to a scholar site. And we're going to work with you probably starting even as early as a year before you're getting ready to graduate. So, you know, it may not necessarily be where you have your residency. It could be another site. So we just want to make sure to work with you. We're going to take into consideration your needs and your interests. But again, ultimately, we're going to have you serve where you're needed most. And just as a follow-up to that, then, can you describe where the sites tend to be? Do they tend to be in rural areas? Are they in urban areas? What is that range of geographic and perhaps sociocultural locations?
Sure. Okay, great. And this is a great question. So we do have sites in a variety of settings, rural and urban. When we look at the higher HPSA scores, they do tend to be in more rural areas. We have many Indian reservations, but we also have some in more urban settings. We have prison sites are also one of the types of facilities where our clinicians work. So that can be closer to a more urban setting. Again, you know, in major metropolitan cities, we don't tend to necessarily have a shortage of providers. So again, we're keeping in mind that it's to meet the needs of the people and access to services. So, but we do have a few in urban settings, yes. Any other questions? You guys aren't, that's gonna challenge me. This is the first recorded session. This is gonna, your questions could be the questions that people can't answer or ask on the other end. Yes.
I'd like to make a comment. Actually, I did participate in National Health Service Corps into the 1992-95, and what happened is that I did pediatric residency. Towards the end of your residency, you're given a list of all the, I don't know if it's working the same way at this point, where you're given a list of all the areas that have need for that specialty, and you basically interview at those places, just like finding a job. Mm-hmm. And the salaries varies from one place to the next. So
yes. And so the comment in the room here was we actually have an alumni National Health Service Corps from the 1990s, and he was sharing his experience that at the time of residency he received a list of sites where there's needs, and wanted to find out was it along the similar lines in terms of lining up his interviews and finding employment. And it works a little bit similar. We're very excited. I think we've grown with technology, so we now have a job opportunities list on our website that does show all of our sites, their scores, and the vacancies that they have. And so our clinicians are able to search that and work with a placement advisor in our program. So we do have somebody that kind of hand-holds you through the process and helps to make sure things get lined up. But again, we encourage you to visit that, become familiar, and reach out to the sites at any point in your education to start building those relationships and making your interests known, sharing your resume, possibly working out those rotations so that when it comes time to finding a job and interviewing, they have some familiarity with you. They've heard your name, they know your interest, they know your commitment.
Another question came in from Twitter feed. Is there any restriction on the types of educational loans that would be repaid as part of this program? For example, is there a restriction on private loans that were used to cover the cost of the education versus the federal loans?
Yes, there are some restrictions, and I'll be honest, all of that criteria is available, the eligibility, and it does list out all the various types of loans, including the private loans. So please visit our website for more detailed information. Yeah. Yes.
I have a question about the scholarship application process. Do you apply when you're applying for medical school, or do you have to wait until you're already attending medical school?
That's a great question. So the question in the room was, when can you apply for the scholarship? Is it before school or once you're enrolled? And the answer is the earliest point that you can apply is once you have received a letter of acceptance and are enrolling in an accredited school, you're able to apply. And we are trying our best on our end to educate all the financial aid offices and all the major schools to make them aware of the opportunities. And, you know, if they can assist you, if we can assist you, yeah, great. Yes?
Another question. Is the ultimate decision on where the physician works, is that up to the physician, or is that a program placement decision?
Are you speaking in regards to scholarship?
In regards to the scholarship program.
Okay, great. It's a little bit of both, and we have scholars that have interest in serving in a variety of places, but again, as I spoke to it earlier, it doesn't always mean that there's a shortage. Again, the scoring every year, there's a new threshold that's established for our scholar placements about what type of scores the sites must have for them to serve, so that might eliminate some or help to actually steer you, it might narrow your options. But we're going to work with you because we want you to be happy. We want you to see yourself actually working beyond your service obligation. So we want to make sure that we're trying to meet the needs of you as a clinician, if you have a family, you know, we take all of those things into consideration. Again, we're paying one-way relocation expenses, so we want to make sure that you're able to go and get established and settled in the community. So we're trying our best not to send you to a place where you don't want to be, but it may not be your first choice. So we're going to work with you on that.